This interview is provided by Sun Pharmaceutical Industries, Incorporated. Acne is the most prevalent skin disease affecting up to 50 million Americans and around 85% of people between the ages of 12 and 24. Dermatologist Julie Harper is here to help us treat and prevent breakouts at any age. Welcome, Julie. Great to see you.
Thank you for the opportunity.
Of course. Okay, tell us, Julie, what exactly is acne?
Well, I think most of us recognize acne when we see it. It can be little blackheads or whiteheads. It can be inflammatory lesions, so red bumps, some of them filled with pus, sometimes deep, tender nodules. But what's really important is what's going on underneath the skin, down in that hair pore or the hair follicle. We're getting too much dead skin in those pores, and the dead skin and oil together clog the pores, and that's what really leads to the acne that we see.
Interesting. Okay, and what are the 4 elements that contribute to acne?
Well, these 4 elements are key because they're also our targets for treatment. And they are, number 1, plugging of that follicle. Number 2, inflammation. Number 3, Cutibacterium acnes or C. acnes, which is a bacteria involved in the development of acne. And this is not an infection. All of us have C. acnes on our skin, but people who have acne are responding more to it with more inflammation. And then the 4th one is sebum or oil, largely under the influence of androgen hormone, which is male hormone, but yes, it's present in men and women. And that's why we get oily and start to see acne right around puberty.
Okay, and how is mild to moderate acne typically treated, Julie?
Well, we're always going to do best if we go back and target those 4 things we just listed. And so, for example, we can use topical retinoids. They really target that follicular plugging. We could use benzoyl peroxide or topical or oral antibiotics because they target C. acnes, the bacteria. They're also anti-inflammatory. The hardest one for us to target has been sebum or the oil, because what we do is to block that. We're blocking through that androgen or male hormone pathway. And so we've been able to do that with pills, but if you think about that for very long, we can only use those in women because we cannot give a man something that's going to block male hormone that's going to have a full body effect.
Yes, that's so true. And tell us about the treatment option with the first novel topical mechanism in nearly 40 years.
Yeah, we shouldn't be treating acne the same way that we did 20 or 40 years ago. So we now have Winlevi 1% cream. It's FDA approved to treat acne in those 12 years of age and older. And it allows us to block that androgen, those acne-inducing hormones, from a topical standpoint. So this is applied topically to the skin. So we can use it in women and men because we're not going to get that full body effect that we would have if we were using this as an oral. We know this is FDA approved. We've got great data as far as efficacy goes. We're also always very interested in safety. And in the clinical trials, the most commonly reported adverse events happened in 7 to 12% of people. And they were local skin reactions, things like running of the skin, burning, and peeling of the skin.
Oh, interesting. What a great option for people who have acne. And where can viewers go for more information, Julie?
Well, go to your dermatologist, but if you'd like more information about Winlevi in particular, you can see the full prescribing information at winlevi.com.
Amazing. Thank you for joining us today, Julie. Have a wonderful day.
Thank you.